Dr. Chiledum Ahaghotu is the head urologist at Howard University Hospital here in Washington, D.C. I asked him to explain what a vasectomy is.
A vasectomy is a minor surgical procedure whereby you tie off the tubes that bring the sperm from the testicles to the outside of the body. And so by tying off those tubes, you render that individual sterile so they cannot have children. It's an elective procedure. It typically takes about 30 to 45 minutes to do. It can be done in the office, actually, under local anesthesia. And it is, for the most part, considered an irreversible procedure, even though we do have techniques to reverse it. But going into the procedure, we like to tell patients that this is pretty much a permanent type of procedure.
And is it effective immediately once the procedure is done, the man becomes sterile?
It is not effective immediately. In fact, because you are tying off the tube at a certain point, there still can be possible viable sperm that can get to the female reproductive tract during intimacy. And so it takes about 2 to 3 months to assure that all of the semen is cleared out of the tubing system before you can render that individual or designate that individual as being sterile.
So is there a test that is done after 2 to 3 months, or the person
That is
can
correct.
consider?
Most of the time we'll have the patient come in somewhere between 60 and 90 days to do what we call a semen analysis. We analyze their semen to ensure that there are no sperm within the semen fluid.
Does it mean that once the male has a vasectomy, the woman does not have to do anything to prevent pregnancy?
Once you confirm sterility, then you don't have to worry about any kind of contraceptive for the female. Now, I always like to emphasize the fact that vasectomy does not prevent sexually transmitted diseases or venereal diseases.
Are there any long-term effects?
Occasionally, immediately after a vasectomy, there may be a little bit of bleeding into the scrotum, and so you can get what we describe as a hematoma, which is a swelling of the testicle. Sometimes it's large enough that it requires evacuation. This complication of surgery doesn't happen too often, but it is something that we do see from time to time, and you usually see it within the first week of the surgery. From a long-term perspective, the only concern that one may have from a vasectomy is the rare or uncommon possibility that somehow or another the tubes reconnect. And so down the line, the patient may go from being sterile to being fertile again. And so that has been described in the literature. It doesn't happen often. That's why you don't get a 100% success rate. It's about maybe a 98% success rate.
Now, apart from contraception, is there any other reason why a man might get a vasectomy, whether it's medical or?
No, there are no other reasons to do a vasectomy other than for contraception. And there are no long-term effects on male potency, male libido, or any other aspects to the male's health other than the fact that the tube will be tied and therefore there'll be no semen that can get to the outside.
Is there an age limit in terms of getting the vasectomy, or can a man get it even at 75?
There are no age limits in terms of upper age limits. Of course, there's no indication to do a vasectomy prior to puberty because one is not sexually mature at that prior to puberty. As opposed to the female, that there is a limit to the reproductive potency in females. There is no real limit in the male. So men in their 70s and 80s are still fertile. Or still can be fertile and have kids. And so if one is still active and concerned about having children, a vasectomy could be done in an elderly patient. But the vast majority of patients that get vasectomies usually do so somewhere in the 20s, 30s, and 40s.
And that's all for today.